Hello everyone. So today we will discuss about the organic irritant part 2 animals. Today we will discuss about the snakes and scorpion. Okay. So now we will discuss about the families of snakes. The first is the colubridae, which are the harmless snakes. Okay. Second type is the elapids, also known as cobras and its allies. And the third is the viperids. Okay. These are called as vipers. Now the elapids are elapinae and hydrophinae. So the elapinae include cobra, common cobra and krait, and hydrophinae includes sea snakes. So now we will learn the difference between the poisonous and the non-poisonous snake, or the venomous and the non-venomous snake. The first difference is between the head scales. The head scales of poisonous snakes are small, but there are few exceptions like pit viper, cobra and krait. Pit viper have a heat sensing anterior inferior to the eye pit, okay, at the head, and cobra it have the third labial which touches the eye and the nasal shield, okay, and in krait they have only four infralabials and fourth one is the largest, and the non-poisonous snake have large head scales. Okay, the belly scales of poisonous snake are large and they cover entire breath, and the non-poisonous have small belly scales. Fangs of poisonous snake are long and canalized because they contain venom. Okay, and the fangs of non-poisonous snakes are short and solid. The tail is markedly compressed, and that it is not markedly compressed. And the bite mark is 2 in the case of poisonous snakes. Okay, and in non-poisonous snake there is number of small teeth marks in the row. Okay, and the habits, poisonous snakes are usually nocturnal, and non-poisonous snake are not so nocturnal. Okay, there is no habits like that. Now we will see the features images of the head scale. This is how the head scale of poisonous snakes look like. These are the small scales. Okay, these are the small scales on the head, but in case of non-poisonous snake they have large head scales. Okay, and another is the belly scales. These are the large scales which covers the entire body. Okay, and the non-poisonous snake have this type of small belly scales or moderately large scales. Now we will learn about the characteristic features of individual snake and how to identify them as an image based question. Okay, the first one is the common cobra. Okay, you have seen it many times. Okay, so this is the common cobra. Here the third labial, first, second and third labial, it touches the eye and the nasal shield. Okay, as we have learned in that previously. And the cobra has a hood. Okay, on dorsal aspect we have spectacle shaped or bicellate mark. Okay, this is also known as spectacled cobra, and on the ventral aspects we have two dark spots. Okay, common cobra, the fatal dose is 15 milligram. This is the image of king cobra. It has a hood which is large but narrow, and also it has a white or yellow color band. You can see this over whole body. Okay, this white and yellow color bands, and the belly scales are large as we have learned previously. Okay, now the fatal dose of king cobra is 12 milligram. Now this snake is Russell's viper. Okay, this is another picture of Russell's vipers. So the features of Russell vipers are that it has a triangular head. You can see the head is triangular. Okay, and it has a short tail and narrow tail. Okay, and there are three rows, one, two, three rows of chained spots. Okay, it can be elliptical or diamond shape. So these are the characteristic features of Russell's viper, and the fatal dose of Russell's viper is 40 milligram. Now we have another type of viper that is also known as saw scaled viper. It has scales like saw, that is they are serrated. That's why the name. Okay, and this is another image of saw scaled viper. They have vertical pupil. The Russell's viper also have vertical pupil. and they have diamond shaped marking, but they have a wavy white color line. You can see the wavy white color line which is present, okay, in the saw scaled viper. Okay, you can remember the 5V about the vipers. First V is for viper, second V is for viviparous, third is for vertical pupil, fourth is for vasculotoxic venom, and fifth is for vertical head, triangular head, V-shaped head, that is triangular head. Okay, the fatal dose of saw scaled viper is 8 milligram. So the next image is of a pit viper. There is an heat sensing pit anterior inferior to eye, between eye and nose. Okay, so this is the image of pit viper. Now we have the image of a common crate. Okay, it has white color bands, okay, all over the body, and the infralabial scales, they are 4 in number, and they are, the fourth scale is the largest. Okay, and it is the most potent snake among all Indian land snakes. Okay, so it has a so the fatal dose is very less, that is 2.5 milligram to 6 milligram. Okay, so it is the most potent snake. Now this is an image of a banded crate. Okay, this, the body of the snake is triangular and the band is also triangular in shape. Okay, it has an inverted V mark over the head. Okay, uh, so this is banded crate. The fatal dose of banded crate is 10 milligram. They have alternate yellow and black band over the back. Now we will learn about the signs and symptoms, okay, of specific snake bites. Now what is ophitoxemia? Ophitoxemia is poisoning by snake venom. Okay. Now the most common symptom following snake bite is fright. That is fear of sudden and unpleasant death, even if the snake is poisonous or not poisonous. Sometimes it may cause, fright is so much that it may lead to shock, psychological shock, and even death in some cases. Okay. Now the first we will talk about the elapid bite, that is cobra and crate snake. That is, they are neurotoxic poisons. Okay, they have neurotoxic poison. Their venom contains neurotoxins. The local features, they start within 6 to 8 minutes. Firstly, there will be fang marks, pain, swelling, serosanguinous discharge may be present, and there is usually wet gangrene. Sometimes blister formation is also there, and they begin within 6 to 8 minutes. So this is the image of how does bite mark look. Okay, how does the local symptoms look in a case of elapid bite. Okay, there is serosanguinous discharge, pain, swelling, and blister formation. Okay, and there is also wet gangrene. Now we will learn about the systemic features of elapid bite. Okay, as the venom is neurotoxic, so the systemic features appear after 30 minutes, and the ptosis, it is the earliest neuroparalytic manifestation, which is then followed by ophthalmoplegia. Okay, now thus firstly there is a pre-paralytic stage in which the patient have giddiness, lethargy, vomiting, weakness. Okay, then there occurs paralytic stage in which there is first is ptosis, which is then followed by dyspnea, dysarthria, diplopia. Okay, then this is followed by bulbar paralysis. Okay, and then respiratory failure and ultimately death. Now we will discuss about the viperate bite, that is bite by vipers. The poison or the venom of the bite are hemotoxic or vasculotoxic. Okay. Now the local features, they are same, like there will be pain, swelling, blister formation, but the features will appear more severe and more fast. Okay. Now the persistent bleeding from the bite site is the constant feature of viper bite, because due to derangement in coagulation profile. Okay. There is formation of blisters involving entire limb. In the bite of by crate and cobra, there is not involvement of entire limb, but in this there is involvement of entire limb by blisters, or sometimes even trunk is also involved. Okay. Now the systemic features, we will discuss about the systemic features. Due to derangement in coagulation of blood profile, there is generalized bleeding from everywhere, like there will be epistaxis, hemolysis, hematmesis, melena, hematuria, intracranial bleeding, and the death is mainly due to hemorrhage and shock. Okay. Now we will discuss about the hydrophyte bite. All snakes are poisonous. All sea snakes are poisonous and they are myotoxic. They causes myalgia, myoglobinuria and rhabdomyolysis. So this is the image of how does the viper bite looks. See, there is more severe symptoms and there is involvement of entire limb. Okay. Now we will learn about the diagnosis of snake poisoning. Okay. Ministry of Health and Family Welfare, Government of India had suggested a 20-minute whole blood clotting test. It is a bedside test. In this test, 2 ml of freshly sampled venous blood is taken in a test tube and put aside for 20 minutes. Okay. After 20 minutes, it is gently tilted, and if the blood is still not clotted, it means that the blood has hypofibrinogenemia, which suggests it is a viper bite. A normal 20-minute whole blood clotting test and clot lysis would exclude viperate bite. Okay. Radioimmunoassay is done. It is the most sensitive and specific test for detection of venom. It can detect venom at the levels of 0.4 microgram per liter. Okay. Another test is enzyme immunoassay. It is most commonly used. It can detect venom levels up to 5 microgram per liter. Okay, minimum 5 microgram per liter. Now, the prevention of spread of venom. The right approach is used. R for reassurance, I for immediate immobilization of the affected limb or the bitten limb. Okay, G and H stands for get to the hospital immediately, and T stands for tell the doctors about the systemic symptoms that are developed in the way. So it may be easy to identify the snake or type of venom in the snake. Now we will learn about the treatment of poisoning by snakes. Okay, the this is the anti-snake venom, also known as polyvalent ASV or PAV. It is effective against common cobra, common crake, Russell's viper, and saw-scaled viper. It is produced at the Hafkin Institute, Mumbai, King Institute, Chennai, or Serum Institute of Pune, and Kasoli in India. Okay. Now, it is the recommended initial dose of ASV is 8 to 10 vials intravenously, and one vial of PAV or polyvalent anti-snake venom, it neutralizes about 6 to 8 milligram of venom. Okay. Now the maximum effect is seen within 4 hours if given within 4 hours, and if it is delayed up to 8 hours, then it is of less value and there is no use or minimum use after 24 hours. So the polyvalent anti-snake venom, it should be given as early as possible. Okay. Now, the children require same dose as in adults because the amount of venom injected is same, and there should be no test dose should not be given because it may hypersensitize about the venom. Okay, so this is the treatment part. And if ASV is not available, then 40 milliliter of antivenin is given IV. It is effective against cobra and Russell vipers. Okay. Now we will learn about the scorpion bite. Okay, it is called as Mesobothus tamulus, also known as Indian red scorpion. So the venom of scorpion is present in its tail. Okay, the venom is either hemolytic or neurotoxic. If the venom is hemolytic, it produces symptoms like viper bite, and it is neurotoxic, then it produces symptoms like cobra or crate bite. Okay, it is a potent autonomic stimulator which which results in release of massive amount of catecholamines from the adrenals, and it also has a direct action on myocardium. Okay, the treatment is the prazosin, that is it is a post synoptic alpha blocker which blocks most of the symptoms of the venom, and the basic treatment is same as in poisoning by snakes. Okay, and antivenom can also be used. This is the image of Indian red scorpion. You can see the tail which is enlarged. It contains poison. Okay.